Start. पकड़ दो. आम पकड़. So on the side view, the neck, which is quadrangular in shape, this is the anterior midline, this is the sternocleidomastoid muscles, and this triangle, it is considered as an anterior triangle. The anterior triangle, which is further divided by the three muscles, this is the anterior bilium digastric, this one is the posterior bilium digastric, and superior bilium humoid. This triangle, these three muscles which divides the anterior triangle further into the 3.5 triangles. The unpaired triangle, it is the submental triangle. So submental triangle, which is formed by the, on each side, which is formed by the anterior bilium digastric, base which is formed by the hyoid bone. This one is the content, which is the very small lymph node which is lies inside the submental triangle. It is the submental lymph nodes, and small vein, it is the submental vein, and this submental vein become continuous as a antejugular veins. Floor, which is formed by the myloid muscles. So first triangle, it is the submental triangle. So submental triangle, both sides, which is bounded by the anterior bilium digastric, base which is formed by the hyoid bone, roof formed by the skin, superficial fascia, as well as there is a platysma muscles and investing layer of deep cervical fascia. So which makes the roof of the triangle. Content, which is formed by the submental lymph nodes and submental veins. These are the content of the submental triangle. Another triangle, it is the digastric triangle. The digastric triangle, which is formed by the anteriorly and inferiorly, which is bounded by the anterior bilium digastric. Posteriorly and inferiorly, it is bounded by the posterior bilium digastric. I have got this posterior bilium digastric. Along with it, there is one muscle, it is called the stylohyoid muscles. This one is the stylohyoid muscles. So the anteriorly and inferiorly, it is bounded by the anterior bilium digastric. Posteriorly and inferiorly, it is bounded by the posterior bilium digastric. Base, which is formed by the, we already removed the mandible. So base, which is formed by the lower border of the mandibles. So base, which is formed by the lower border of the mandible, and from the angle of mandible to the mastoid process, you have to draw the line which contains the, this is the digastric triangle. The digastric triangle further have a two part. The anterior part, it is considered as a submandibular triangle, and posterior part, it is considered as a parotid part of the digastric triangle. Roof, it is formed by the skin, superficial fascia, investing layer of deep cervical fascia and platysma. Floor, which is formed by the most anteriorly, there is a muscle. This one is the muscles. It is the myloid muscles. The posteriorly middle part, it is formed by the hyoglossus muscles. Here you can see this is the hyoglossus, and most posteriorly it is formed by the middle constrictor muscles. The content of the digastric triangle, this one is the submandibular gland. Along with the submandibular lymph node, we already removed. Facial vessels, this one is the facial artery and veins. Submental arteries, glandular branches, now to mylohyoid. Here you can see, this is the now to mylohyoid. This one is the now to mylohyoid, which supplies to the myloid muscles and anterior bilium digastric. Digastric triangle also On the posterior aspect or parotid part, it contains the lower part of the parotid glands. Inside the parotid glands, you can see there is a artery, most deep part, it is the external carotid artery. This one is the retromandibular vein, and we have not dissected the facial now. But these are the content within the parotid glands are the external carotid artery, retromandibular veins, and there is a facial nerve. We have not dissected the facial nerve, but these are the content within the parotid glands. Another triangle, it is the carotid triangle. It is the anteriorly and inferiorly it is bounded by the superior belly of digastric. Posteriorly and superiorly it is bounded by the posterior belly of digastric with the styloid muscles, and most posteriorly it is bounded by the anterior border of the sternocleidomastoid muscles. Within the carotid gland, carotid triangle, you can see there is a common carotid artery. I have reflected the sternocleidomastoid. This one is the internal jugular veins, and along with it, inside the carotid sheath, this is the vagus nerve, and the carotid artery, common carotid artery, which divide into the two branches, external carotid artery and internal carotid artery. Over the common carotid artery or carotid sheath, this is the anterior superior root of the ansa cervicalis. This one is the inferior root of the ansa cervicalis, and this both ansa cervicalis, superior root and inferior root, which is connected on the lower part of the carotid sheath, and it innervate to the infrared muscles, mainly the sternum to hyoid, sternohyoid, sternothyroid, and inferior biliocomoid. This is the inferior biliocomoid. The superior biliocomoid, which is directly innervated the branches coming from the superior root, and the geniohyoid and thyrohyoid, which is innervated by the fiber of the C1, which is goes along with the hypoglossal nerve. This is the hypoglossal nerve, and the fiber which is goes inside, this is supplies to the thyroid, and again this fiber goes anteriorly along with the hypoglossal nerve, and here at that level it is supplied to the geniohyoid muscles. Inside the carotid triangle also the external carotid artery gives the 5 branches. The first branch here you can see in this body there is a variation. The superior thyroid artery, which is arise from the common carotid. After that there is another branch, it is the facial artery. On the medial side here you can see this is the lingual artery, and on the most medially you can see there is ascending pharyngeal. Posteriorly you can see there are 2 arteries, occipital artery and one more artery, it is the posterior auricular, and this posterior auricular, again these are the 2 arteries of the external carotid artery on the back side. This one is the posterior auricular and this is the occipital artery. 3 anterior branches. First one is the superior thyroid, second is the facial and lingual artery, 3 artery which is coming anteriorly, and one which is goes medially, it is the ascending pharyngeal artery. After that the external carotid artery inside the parotid gland, it divides into the 2 terminal branches, superficial temporal and maxillary artery. And the last triangle inside the anterior triangle, it is a muscular triangle. The muscular triangle, which is formed by the anteriorly by the anterior midline, posteriorly and superiorly by the superior of humoid, and posteriorly and inferiorly it is formed by the anterior border of the sternocleidomastoid muscles. And roof, which is formed by the skin, superficial fascia, investing layer of deep cervical fascia. Floor, which is formed by the infrared muscles, and infrared muscles which is innervated by the ansa cervicalis. At least here. And deep dissection I have done. Here you can see this is the inferior nerve, and it continues as a mental nerve and vessels. Just deep to this, here you can see this is the lingual nerve. It is sensory to the tongue. Bas